Bob and Brad, the two most famous physical therapists on the internet.
Howdy, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course.
Wake up,
Bob.
Brad. Wake up.
I'm feeling strong.
Today we're going to talk about low back pain. You know, there's really a lot of information out there, Brad.
There is.
So we're trying to narrow it down to what we think you really need to know. So we think you need to know, are you a flexor, extender, shaker, or compressor? You might also be a combination of these.
Right.
So we're going to go over how you can determine what you are. This will help determine what exercises you should do, and it will also tell you what things you should avoid.
Right.
Because they're both could be harmful to you. So, but before I do that, I want to give the example, Brad, of a flexor and an extender.
And before we go further than that,
Oh,
I think that it's important to note that we're getting a lot of this information based off of
Stuart McGill.
and
Robin McKenzie.
right.
And,
Well, yeah, they've
a
kind of
little smattering from
piggybacked
here.
off each other a little bit. They all work together with time.
So the quick story. My wife and I got a California king size mattress from Sleep Ovation.
Oh, I thought you were going to say from California.
No, not from California. And you know how they come?
Yeah.
They come in a box.
Yes.
And the box weighed over like north of 110 pounds.
Whoa.
So pretty heavy.
You got to be careful, Bob.
Right. So it's delivered to my door. I struggled to get inside. I'm like, I'm not going to have my wife help me with this. She's going to hurt her back.
Right. Yeah, you're a man.
Yeah, I'm a man.
6'6", you should be able to
That's right.
tackle that.
So I slid it up the stairs. Very difficult. I get to the top. I open it up, and you know how it expands.
Yep.
But once it expands, it's very difficult to move.
Why didn't you put it in the bedroom and expand it?
I did.
Oh, okay.
But I still had to slide it over onto the frame.
Mm-hmm.
So I started sliding over on the frame. The last push, zap.
Ah.
Oh, I got a zinger.
Yeah.
I mean, I couldn't even stand up straight. All I could do is lie onto the bed. So I lied onto the bed. And while I'm there, I'm thinking, I've got to host golf next weekend.
Yeah.
12 guys are coming.
Yeah.
And I'm not going to be able to golf. There's no way. I couldn't even walk.
So you're thinking about
I'm
how
thinking
this is
about
going to
how it
affect your
affect my
life.
life. Yeah, I'm not going to be able to help my wife with chores. I'm not.
Well,
that's best.
That's not a big deal.
That's probably a big thing. So
Yeah, so you're thinking recreationally mostly.
yeah, well, somewhat, but you know, you realize how it does affect your life tremendously.
Changes your life.
So Brad is on the other end of this.
So you're saying you were actually bent over
Yes.
when the event happened.
Yes,
You
that's
were-
what
that's
caused
why-
me. Oh, that's a flexor.
So flexion, bending, started it and irritates it.
and irritates it,
Yeah.
right? So what you want to tell your story about an extender?
Extender. Well, in other words, with my back, I have spondylolisthesis. Although if you have stenosis, or you may be an extender without those two diagnoses, you know if you're an extender is if doing this kind of activity.
And we'll show this. We'll have you try that. But I mean, did you go through a period when you were dealing with this? I know you couldn't run for a while.
Running and walking, I could not walk, which is a form of extension, not excessive, but a mild extension.
Your back, yeah.
I couldn't walk for more than 3/4 of a mile without getting sciatica down my right leg, and that was for about a year. And then I continued to.
Yeah, Brad's a very active guy, and so this was greatly affecting.
But I could bike.
You could bike.
I could bend over on my
bent
back.
Over.
So that didn't bother. But things like this, or laying on my stomach where my back went backwards, standing for any period of time, going shopping and watching
overhead
my wife.
work.
Bob,
right?
I'm talking about my story.
Yeah.
Yeah. Or that's right, working overhead, get a backache. So anything where overhead, standing for a long period of time, or walking, always irritated my back, and I got sciatica with it.
But did you start to realize your mortality, that like, I can't do these things?
And I was actually considering going to see the surgeon.
Sure.
But then I figured something out, luckily. We'll get to that.
We'll get to that. So let's talk about first, flexor is probably the most common by far.
I think
right?
so.
Wouldn't you agree? So I'm a flexor, and here's some of the common questions. If you answer yes, you may be a flexor. Are you generally worse when you're sitting? Like when you sit for a prolonged period and when you get up from sitting?
Yeah, does that?
Oh,
but then after you get moving, it settles out.
Right, feels better. Are you worse after prolonged bending, like vacuuming or ironing or digging or gardening?
Exactly.
So
Shoveling.
is it better with walking? Usually, like Brad said, it hurts at first, but once you get going, it feels better with walking.
Right. Not with me. That would be
Yeah.
with Bob.
Funny for me, actually, it actually felt better with running too. And I ended up being able to golf the next week because I went back to running the next day, and it just seemed like it worked its way out. And generally, it's going to feel better when lie down. It might be worse at first, but once you get straightened out and let things calm down, it feels better.
And oftentimes prone on your stomach feels good in that position or with that.
Yeah. Simple
back
test
problem.
is you could do repeated flexion. You could do it from a seated position or a standing position, or you could even hold it for a prolonged period of time.
Yeah. So you might be like this.
Yeah.
And if it starts to irritate it, it might right away. But if it takes 10 or 15, 30 seconds, all of a sudden, whoa.
You may be a flexor. Okay. If you're an extender, it could be a number of things like we talk about spondy or arthritis or spinal stenosis. If it's spinal stenosis, usually you're over age 50.
Yeah.
So you're started
unless you have
right?
spondylolisthesis,
Right.
Then because of the shift of the vertebra, you may have some stenosis.
Because you got it younger than that, right?
Yeah, I'd have to think about it.
But you got injured and you remember the injury. So is it worse with the back extended for a while? So you want to show that what extension means, Brad?
This is extension.
Yeah.
But even just standing up is extension. If you're standing, pain, and you sit and immediately the pain goes away, you're probably an extender.
And yours was also better with, worse. Never mind. I completely lost my thought there. Okay, now we're going to talk about it's also worse with walking, right?
Now it isn't, but it was at one time.
Oh, sure.
Yes. Yep.
Generally, for people, they call it shopping cart syndrome, where they actually lean on a shopping cart and it feels a lot better.
Right.
And as soon as they sit down, like you said, it gets better.
Yeah. And it doesn't have to be a shopping cart. You could lean forward on your car.
Sure. There we go.
Just had to say something.
You want to stand up once, Brad? Okay. One test you can do is you can actually, Brad can lean back into one side.
Oh, yeah. If we want to.
Yeah.
Go back.
And one side. And you can even push down through the shoulders a little bit to see, add a little bit more compression to it. Now or the other way. Do any of these bother you, Brad?
No.
So you tend to be bad, again, with repeated extension.
Or static length of time. I know if I stood like this for about 3 minutes, I would really want to sit down.
Does it make it worse if you put your arms overhead and back?
Yeah. Well, yeah, if I do things overhead, that's a good way for me to get a backache that'll last for a day.
So again, the spinal stenosis, spondy, all those things don't make it worse. Are you a shaker?
Oh, okay. Yeah, I'm shaking.
So I'm going to show this on the model.
Shouldn't make fun of back
This
pain.
is what makes a shaker. So if you go take a look, okay, we got 3 discs here. Now, one of these discs is a bulging disc and it's weakened. It's lost some of its stiffness. This disc and this disc have normal stiffness. Now watch when I start turning.
So we're looking at the disc right here. See, the blue lines are just reference.
Yep.
And so we're looking at the low back here. We're looking right about at the belt line level.
Yep. There's too much movement at one segment. So your back is unstable. So you're going to feel that. These are the questions that you're going to ask yourself. One, let me get to my spot here. Does your back have a feeling like it's giving way, or does it spasm on you?
Or it's like you move a certain way, all of a sudden, it kind of takes your breath away, but it's short-lived oftentimes, and you can, kind of
you might feel some
out.
Catching or locking while you're bending or twisting to your back. A sign that's really normal, Brad, is twisting bed.
Rolling in bed,
yes,
side to side, and you go, so you really take your time.
Yeah, exactly. That's an unstable back, and or going from sit to stand would be another one. So All right, the final one is the compression. Again, you can have a combination of these.
Mm-hmm.
So with compression, you don't like it when your spine is compressed together. And that happens when you're lifting something like
Mm-hmm.
weightlifters. Brad's going to show a test for that right now. You can actually just, while you're in a chair, you can first bend forward, straighten, and then bend back
Yep.
and see how it is. No pain.
Yep. Feels okay.
Then Brad, what are you going to do?
Well, I'm going to bend forward. I'm going to grab the chair wherever you can get a hold of it, and then I'm going to pull down and actually compress the spine in a flexed position and see how it responds. Does it feel good? Does it feel worse? Does it create pain? And if it creates pain with that, whoa, then you know that's a compression issue in a flexed position. And then you can try good tall posture, grab again, pull down, see how it feels, and then extending backwards, and then pull down and see how it feels. And then note which one irritates it, and if two don't irritate it. I would say the majority of people may experience
With flexion.
pain with flexion
Yeah.
and compression.
Right, right. So another way to do this, just real quickly, is if you have a weight like this, it's an 8-pound weight, and you keep it close
Mhm.
and you bend, there's no problem. But if you put it out here, that puts a lot more stress on your back.
Mhm.
And this is the one that actually hurt my son's back. When he extended
Oh,
and
sure.
and put the arm out like
Now,
this.
should that test be done seated or standing?
Either way.
But either way,
Yeah.
you probably want to have not on a firm chair,
Right.
not on a couch or something
Right.
like that.
Probably standing would
Yeah,
be best.
probably.
So now, once you determine what you are, let's talk about the flexor first.
Mhm.
So you're going to avoid bending forward like that. You're going to
Yes.
keep the back straight when you bend forward.
All right, so you're probably going to do this
Right.
as opposed to this, but you're going to keep the back straight one way or another.
But the where you really round out, become a C,
yes,
that's where you're really troublesome.
oh, and you'll feel it.
So you're going to learn to keep your back straight, and we're going to have a series of videos on what to do when you're a flexor
Mhm.
extender. I'm just going to touch upon it
Sure.
lightly here. If you're extender, you obviously want to avoid extension.
Right.
I mean, that's going to fire it back up. You want to stretch your hip flexors, believe it or not, because if your hip flexors are tight,
Mhm.
they'll extend your back.
Sure.
So if you're a shaker, you really want to work on your core strength.
Right, because it's like a back belt, that's going to stabilize and keep that spine from moving around and giving you that sharp pain. So, and you're
Exactly.
something you really have to think about is your position of your pelvis and your back, and tighten things up and
Yeah.
get to the point where you don't have to think about it. You just do it
I
automatically.
think a really good example, Brad, is the people that turn in bed and it
Mhm.
hurts. I had a patient like this that worked just beautiful. He's like, I can't get out of bed without it really hurting.
Yeah,
So all we had him do is tighten up his abdomen
yeah.
and then turn out of bed. And he had no pain then.
So he had
Yep.
his own back belt
Yeah, his
basically
back
built
belt.
in, and he just used it.
So that's all you got to do is start by tightening. You can put your fingers into your sides to see if you're tightening your abdomen. And if you're a compressor, you want to make sure your back is in neutral. It's not flexed, it's not extended, and you want to be in neutral, and you want to tighten your abdomen too.
You probably want to avoid lifting heavy things.
Yes, yes.
Even light things.
Yes.
Until things get better.
Unfortunately, some young guys often hurt their back because they use too much weight and they actually damage the end plates on the vertebrae.
Sure.
That's getting a little technical, but that's what happens.
I've got my niece. She's about 35. Aggressive worker out or workouts.
Sure.
She's in that.
CrossFit.
Yeah, I'll get in trouble here.
I was gonna
But
say
that is an aggressive group.
Yes, it is.
She's 35 and she just had back surgery.
Oh, she did.
Yeah, and it sounds like the surgery went well, but I could talk
what I've
blue in the face
Yeah,
and say,
but
don't do this and that.
The
But
thing is on CrossFit, if you have a good instructor, they're going to teach you the right way to do things.
and they're gonna maxing everything out because that's the mindset.
Yeah,
of CrossFit.
I know.
I know, because I'm one of those people. I think I would
know.
be in CrossFit if I was.
I know if you were
25,
younger.
for sure.
So I like CrossFit though. I mean, I think it does some good things, but yeah, they go a little crazy.
Pretty damn
Yeah.
crazy.
So, all right,
Be fun, though.
those are it. Those are the 4 things, and we will have some future videos. We'll talk about if you're a flexor, what you should do in great detail.
Sure, you betcha.
So, all right. Remember, Rad and I can fix just about anything
Except for
a broken heart.
And we work on that on
I feel like you've been kind of lagging. Though.
I have, Bob. This is winter time. It's dark in the morning. You wake up. I can't think about the old broken heart. I can hardly think about getting out of bed sometimes because it's so fun.
All right. Thanks for watching.